My guest today is Dr. Jennifer Waljee, plastic surgeon from the University of Michigan. As you'll hear, she has already achieved great heights at Michigan. She is a full professor and has a multitude of responsibilities both at her institution and outside medical organizations national and internationally. She has 242 research publications, which is absolutely staggering. And all of these impressive accomplishments over her 12 years as an attending surgeon would certainly prove that she is walking on rarefied ground as an elite academic surgeon. But it is the manner in which she goes about achieving her success which is truly special to me. I didn't know her well when I was a plastic surgery resident at Michigan. Dr. Waljee was a general surgery resident at that time. It was only years later when I would see her at the plastic surgery division reunions or national meetings where her name seemed to be everywhere. She not only appeared to be contributing to every facet of administrative and clinical care at the university, but her research has had national and international impact as well. Jennifer facilitates positive interaction amongst her junior and senior partners within the division. And let me tell you, from personal experience, some of the senior surgeons at Michigan are not the easiest people with whom to work. She was in charge of the last alumni symposium at the University of Michigan Plastic Surgery Division, and it went off beautifully. I was really impressed how she managed to hold together a great meeting that included the current faculty and residents, as well as a large number of crotchety old surgeons from the outside. And she has been truly able to bridge the culture between old and new within surgery. Jennifer currently holds the record for the fastest response time to say yes to guesting on this podcast as well. It was no more than exactly 5 minutes after I sent the email invitation that she replied that she would be glad to do it. And as you can tell, she managed to fit in this recording after being in the OR, on call, on a weekend, when she could have gone and should have gone home instead of staying at the office. I'm extremely grateful for the gift of her time. This is what success in life looks like. It is not being afraid of hard work, humility, the ability to work well with others, and a fierce inner drive that you only see when you step back and look at what she's accomplished. Dr. Waljee is soft-spoken, but her words do carry great weight. I hope you enjoy listening to her as much as I did speaking with her. Thank you very much. Welcome, everyone, to another episode of Botox and Burpees, our surgical series. We have with us our guest, Dr. Jennifer Waljee. She is a full professor of surgery at University of Michigan. I guess medical school, right? Yeah, or University of Michigan Medical Center. I don't even know what the right way to say that is. University of Michigan Medical Center. Okay, let's stick with that. Let me talk a little bit about you, Jennifer, and your background, so people know who you are. You graduated from University of Michigan in biology for your undergraduate training, and then you went to Emory University for your medical degree, and you also picked up 2 master's degrees along the way, one in epidemiology at University of Michigan School of Public Health, and then another one also at Michigan in health services research. You did your general surgery residency at University of Michigan, and you did a full, looks like 7 years. So you did 7 years of residency at Michigan for your general surgery training. So it was 5 plus 2 of research. Yes. So for those who don't know, and actually we had a previous guest as well, like nowadays, plastic surgery residency is integrated. So you do a couple of years of general surgery, usually like 3 years of training as a resident, and then maybe like another 3 in plastic surgery. But for the really deep, well-trained, old-school surgeons, they did a full general surgery residency, which is 5 plus usually a couple years of research, which you did. And that's how all of our mentors did it, I think, pretty much. Obviously, things have changed now. And then you did your plastic surgery residency also at University of Michigan, and you stayed on to do your hand surgery fellowship at University of Michigan as well. So just kind of picking through your background, you're now a full professor of surgery in plastic surgery and in orthopedic surgery at Michigan. You are also doing a couple of other administrative responsibilities. You're the vice chair of research strategy for the department, You hold the Zunema Endowed Professorship, and you are also vice chair for both faculty life and health services research. You have one of the longest publication lists I've seen for someone. How long have you been in practice now?
I started in 2012.
Yeah, so that's 12 years, and you have 242 listed publications, which is crazy. That is like one of the most I've seen for someone who's in practice for 12 years. Uh, you are also a peer reviewer for the New England Journal of Medicine, which is, I don't know if I know another plastic surgeon who is a peer reviewer for that journal. Um, as well as like a million other your board, board members and committee members for a number of organized uh national organizations, which I'm not going to get into because there's so many to list. Um, Thank you so much for agreeing to guest, and I really appreciate you spending the time. I know you were operating this morning, and you just got out, so I really appreciate that you were able to to bop over here to do this.
Thank you for having me. I'm really looking forward to our conversation.
So, you are, except for your stint at Emory, a Michigan lifer for the most part. Um, and now you are at the institution that you trained at for the most part. And I always feel like the people who are who get to stay at the institution they trained at are some of the superstars for a couple of reasons. One is they uphold the tradition and the excellence that is that institution that they trained at, and also they really know you, warts and all. And for them to want you to stay, like they know you deep, more better than almost anyone else who comes in as a candidate. So it's really a mark of honor, I think, that they, would want you to stay and become part of their faculty. That was not something that was offered to me when I finished. Trust me. They were like, go forth. Uh, but as you trained at Michigan, is there anything that you remember in particular that was really impactful or really sort of affected you as a, a surgeon in training?
I think there are lots of memories that I have over the years, and I do get to spend time in the same hallways and units that I was when I was an intern. So I think about it in various phases of training. I remember being an intern, and I started on the trauma burn rotation in July. I knew absolutely nothing. And so I remember the kindness of the residents above me trying to, teach me how to take care of really sick patients who had complex injuries. I felt, it's hard to come to a new place right out of medical school. So I try to, you know, remember that and be, particularly mindful of that for our residents that join us in July. It's a tough month. And starting off intern year is really hard. And then I think as I moved through my general surgery training, which I loved, I found that I was really drawn to breast cases and breast reconstruction, and had an opportunity to work with Dr. Amy Alderman. And that was really formative for me. I then took 2 years off for research, and she was one of my mentors during that time. And I found that I really liked the thinking about those clinical questions and how we could impact somebody's quality of life. And then found kind of throughout the rest of training that I was drawn to a little bit more of the anatomic challenge that plastic surgery had to offer. And the first rotation I had when I started in plastic surgery here was the hand service. I didn't know what any of the various letters meant. So the first few cases that I was doing. So that was a pretty steep learning curve. And obviously, Dr. Chung was a tremendously influential mentor on me because now most of what I do is hand surgery. So I fell in love with that and that challenge and variety that comes with that. And I think so. Those things stick out of my mind when I reflect back on training. And I think the other big piece was, we spent a fair amount of time in the trauma burn unit as junior residents and then as trauma chiefs. And so was, very influenced by Drs. Wang and Dr. Hemela, taking care of burn patients and then watching, Dr. Sedurna and others do reconstruction for them later and kind of having that longitudinal experience was really rewarding for me. When I first started on faculty in plastics, they had a need for someone to come back and cover a burn call. And so I did that for a few years, which has been really fun. And I enjoy taking care of individuals with, injuries that require late burn reconstruction still, even if I don't cover the acute burn call anymore. So I think those are some of the experiences that have stood out to me.
You mentioned a couple of the mentors, and I know many of them in the trauma burn unit. I myself was also a resident there. Dr. Chung, Amy Alderman, who was one of my senior residents when I was there training as well. Did any of them just change your mind where you were coming into general surgery, not sure what you wanted to do, and then just suddenly decide, yes, this is exactly why I want to do that? This is why I chose plastic surgery specifically.
Yeah, I think, it was rotating, on the surgical oncology service and then kinda sticking around for the breast reconstruction when I could. I really enjoyed those cases, and those were the places where we got the most exposure. As a senior resident in surgical oncology, I got a little bit more exposure, when plastic would come in and do a complex reconstruction, and it was really towards the end of my general surgery residency. And I remember Dr. Osmer was always so kind to let me stay and could watch some of her cases. And I think that's what really flipped the switch in my mind that, wow, this is, incredible anatomy and the things that you're able to do to manipulate anatomy to help somebody's long-term quality of life is pretty incredible.
And then you ended up doing a hand fellowship. So, what was it that you decided was so appealing about hand surgery itself that made you decide that's what you wanted to specialize in? Because in plastic surgery, there's so much, right? There's, like you said, breast reconstruction, there's micro, there's general reconstruction, there's aesthetics, there's craniofacial, there's hand. Like you could literally choose anywhere on the body to operate on. What was it about like this that made it so fascinating to you?
Yeah, I think I really enjoyed the anatomy. I liked the breadth of um, bony, being able to do bony reconstruction, tendon reconstruction, nerve reconstruction, some microsurgery, um, and feeling like, even sometimes what we think of as, a pretty routine condition like carpal tunnel syndrome has a huge impact on somebody's quality of life. If their fingers catching and triggering, that has a huge impact on their quality of life if they can't type or they can't do the things that they like to do. So I like the fact that it's a huge swath of cases from things that take 5 minutes that really impact somebody's quality of life to cases that are, pretty complex and involve, free tissue transfer and those kinds of things. So I like the breadth and depth of that.
Um, you're clearly no stranger to hard work. You clearly have done a lot in your life as looked when you look at the list of accomplishments that you've had, but also when you mentioned you covered burn care for the first couple years as an attending. Uh, you're operating today. Um, how do you uh, what kind of advice do you give to people who are like interested in what you do in terms of the amount of work and effort that you needed to do in order to get to where you are?
I think that it is, um, I think it's a journey, and I don't always operate on Saturday mornings. It just happened to be, that's what this particular patient needed, and I was on call. But I do think it's really important to think about balance in your life. I've 2 kids, and it's important for me, especially, now that they're a little bit older, they have lots of activities and things that I think our kids need us. Hopefully, they need us for a lot of things that they do, but, I feel like I'm needed in different ways than they were when, they were a little bit smaller. So and when I reflect back on that, when I first started on faculty, my, kids were pretty young, and so they, had different hours and times that they were awake and needed me, than they do now, and so, I think I could kinda structure my life around that. I think it gets easier when you're on the other side as an attending because you have more autonomy over your schedule. It doesn't necessarily mean that it's easy, or there are not going to be things that don't necessarily align with exactly when you wanted to do them. But you do have some choice over, well, this is when I'm going to book these late cases, or this is when I'm going to take call, or this is a hard no for me because of my daughter's birthday, or whatever the situation might be. I also look back on it and, for the most part, I've, really enjoyed all the things that I've gotten to do. So it's not to say that it didn't feel like work along the way, but I feel like they were meaningful and rewarding experiences. And so I think that kind of helps stay motivated every day.
As you went along in your training, and even now, how many years have you been as an attending at this point?
I started in 2012, so this is, I think, my 11th year.
Yeah, okay. So both in training and also now as an attending, what is one way or method that you've used to become better as a surgeon?
Um, I think that, I try to attend meetings as much as possible, lean into our teaching conferences, our journal clubs when I can, but also not just those here, but also the ones that are offered through our professional societies. Um, you know, the webinars and things like that that are at night often are recorded on other platforms, and you can listen to them when you're driving to work or, whenever you have downtime. So I try to do that for my own continuous education. I think I try to be really critical about, why I made decisions. How did that turn out? Was that the right thing to do or not? And I often seek the counsel of my senior partners about, um, should I have done this differently, or how should I have thought about this case? Or if I'm thinking about a case that I haven't done yet, what might be the pearls and pitfalls um, with that? I also think that over time I've gotten more aware of, what I'm good at and what I'm probably not as good at or should be handled by somebody else. And so I'm trying to be more mindful of that and not let my own ego get in the way. I think it's important to me.
Is it what has changed more, your clinical decision making in terms of evaluation and treatment, or have your operations the way you've done them? Like, is a carpal tunnel pretty much still the way you still do a carpal tunnel 11 years ago, or is it that how you decide who gets it, or how how you choose what operation for a particular person with a particular injury has changed more for you?
I think it's a little bit of both. I think probably for the more common stuff that we do, I don't know that the techniques have changed that much. Some have. The way I've managed deeper trends has changed. The way I've managed nerve injuries have changed. For example, thinking about earlier nerve transfers or tendon transfers for individuals with peripheral nerve injuries. So some of those things have changed in terms of the techniques I might choose, but I think a lot of it more is the clinical decision making and or how I counsel patients in terms of what to expect after surgery.
What do you do now that's different than, say, 11 years ago when you talk to a patient about surgery?
Um, I try to be really realistic about what it's going to, what we can fix with surgery or what symptoms we can address with surgery and which ones I don't think that we can. And I think that, whenever we have conversations, we only hear pieces of it. And so I try to keep reiterating that again and again, just because I know that patients are overwhelmed, particularly if it's a patient who has an injury. They're probably hearing part of what I'm saying, but not all of it. So making sure that I'm consistent and, providing them as much information as they need to know ahead of time, particularly on what can I expect in terms of getting back to work, caring for my family, picking up my child. Um, I probably used to say, "Oh, yeah, sure, it'll be 3 to 4 weeks." Now I'm like, it's probably gonna be more like 6 to 8. This is when you can drive. This is, when you can lift things, those kinds of things. I think I'm a little bit more realistic now than I used to be.
What is one of your favorite surgical procedures now that you really enjoy doing at this point?
I love doing Z-plasties. That has not changed. Z-plasties for burn reconstruction is, like, one of my favorite things to do. I like any kind of peripheral nerve exploration, but particularly ulnar nerve, median nerve, radial nerve, in the upper extremity. So, any types of reconstruction and, exploration for those I love.
So the peripheral nerve stuff, is that just because it's sort of a puzzle teasing out and figuring out where it goes, or what is it about that you really enjoy, like when you explore a median or an ulnar nerve?
I think it's just the, beauty of the anatomy. So often it's very consistent. It's right there. I had the privilege of being able to work with residents a lot of the time, and so, taking them through those cases is really fun. And also it's so closely linked to what the patient's gonna experience in terms of, function and sensation.
With Z-plasty, so for the listener, it's when you have it's like a tissue rearrangement. So you have a scar, and maybe it's a scar from a burn, so it's like really tight. And so you have to release that scar. So you make incisions geometrically to rearrange the tissue around it to release that scar tissue and allow better function or movement. Um, I remember I don't do as many for those anymore, but I think the elegance of the geometry and planning it and making it just so that it works perfectly, and then you have this really nice smooth surface where before it was like this big scar band. Is that what you like about it? Or is it just seeing the function afterwards? What do you love about Z-plasties?
Well, I think it's the geometry, and when it lines up nicely and, it alleviates that scar contracture, it's just incredibly rewarding.
Yeah, I love that too. I just love the geometry and how it makes it work. Like there's an aesthetic sense of satisfaction just from doing something like that. I love that. And I think all plastic surgeons have that sense of like just making that soft tissue work the way, like just setting it up nicely like that. Like it's just a nice sense of accomplishment. I think surgeons love accomplishment after a case like you're like, okay, I did something really, really cool or nice there. Like that fulfills that. Um, so when you operate, I know a lot of surgeons, they have rituals. They have certain things that they're always doing. There's certain things that are very important to them. Is there anything that you have that's very specific to your setup or your prep routine or anything before surgery to help you optimize that surgical procedure?
Um, I think that for probably most of the procedures that I have, I try really hard to go through every single thing I think that we're gonna need, and let the team know, so that things then flow smoothly once we're all scrubbed in and we're started, so that people don't have to run back and forth to get a million things that I forgot about. I often will usually pick out the suture that I want, put all that up, put all the dressings up that I want, um, if it's not up already. Because, I just wanna make sure that, we're all moving through this, expeditiously. Um, and so I think for almost all cases, I do that. For ones that, I think are gonna be particularly involved or challenging, I usually mentally go through the steps in my mind multiple times before the procedures, write them out, sometimes, especially if it's, something where there might be some nuance and I wanna make sure that it flows smoothly. And then especially when I'm working with trainees, if depending on what it is, I'll often share, these are the techniques that I'm planning on. This is my personal plan A, B, and C. If you have other plans that you'd like to consider, sure, we can talk about that too. Because I feel like when we're all coming to the operating room, it shouldn't be a pop quiz. Like we should all be on the same page about what we're going to do. Um, we may have different experience in terms of the number of years that we've been doing something, but we should all come there with the same working knowledge of the anatomy, the plan A, B, and C, and what the recovery and prognosis are going to look like.
It's amazing how many surgeons I talk to have that pre-visualization where they're kind of running through it in their head. Multi- and everyone I've talked to has said multiple times. It's not just one time. It seems like it's several times. And then the checklisting is something that seems to be universal for a lot of people doing critical things, is like sort of making sure you have that flow either written or at least mental in mind in order to make sure that you're hitting the steps that you need to in the order that you need to hit them. And I assume that some of the reconstructions you're doing are fairly complex, and you need to make sure that like you're flowing through it stepwise because they're all different too in a lot of cases. So there are many variations probably on a particular type of operation you might need to do for somebody. So, um, what do you listen to in the OR once you get in there then?
Um, I actually let whoever's in the room pick. I'm not super particular about the music, but I do like listening to music. Um, so I would say usually it's some type of, top 40 hits. Um, there's a lot of happy radio and fun radio tends to get played a lot. So yeah, I'm usually open to anything.
Are there any no-goes? Like you're like, no, we have to change it. Is there anything like that? Any genre?
I'm not sure I could probably listen to classical music for a particularly long period of time in the operating room. Like, I need something that's upbeat. So,
That's great. Well, that's glad that you're generous with the OR music. Not everyone is that way. Um, what so when you have your team either in the OR or out, is there anyone that's particularly important to you that makes you, Dr. Jennifer Waljee, the person that you are, either operating or outside the operating room, that helps you be the best person that you can be?
um, I think it's all members of the team. I think that, I have the privilege of getting to work with people for years now, thinking back even to when I was a trainee. So for some people in the operating room, I've worked with them for a really long time. And I really trust their judgment and their wisdom and expertise. And that was really helpful, particularly when I was starting out in practice. You're nervous, you're worrying if you're going to forget something. And it's kind of nice to see the same team members in the operating room because they've got your back. Um, I think certainly the most important people outside of the patient in the room are also the trainees that we get to teach. Because this may be the operation that they've seen 500 times, or it may be one of two that they get to see before they go out into training and then are either doing it themselves or using the principles that they might have learned or the anatomy that they might have learned to apply in whatever way going forward. So I think that's really important.
Now, you've been at Michigan, you did your training there, you stayed on as attending. At what point, and I know this because I had um, seniors who also stayed on as faculty, and I you can't help it. Like, they are attendings, but you kind of treat them like your big brother, like you knew them, like like it took them a little while to sort of grow into that position because everyone knew them as a resident versus an attending. At what point, as an attending, were you like, people aren't treating me like a super resident? I now am an attending at this point.
I think it took a while. May not still feel that way yet. I think it takes a long time, and I think that's okay. I didn't feel that different on June 30th than I did November 1st. And so, um, I think from a trainee perspective, it probably takes, through the period of time that people knew you as a resident. But I hope that I'm still approachable and they feel like they can, ask me questions and it's not intimidating or, come to me with mistakes or those kinds of things or questions and advice that they have. I probably noticed it when you start hearing about, various things that come up. All of a sudden, the residents aren't telling you everything anymore. Like you're not really one of them, and you're like, oh, well, okay. I think they don't want. I think they're ready for me to leave now because they look at me as an attending. Um, so there's probably a little bit of that phenomenon. And then I think with my partners, they were all just really gracious in terms of, giving me advice along the way, especially, when you have complications and you're not sure what to do, you're in your board collection period. They were all really supportive, but also would be, encouraging, like, hey, you've got this, you can do it. And so that was very helpful along the way. But I don't think it was like a black and white switch moment. Took a long time to reflect back on that.
Is there something that you did as a attending mindset that helped you sort of be like, okay, I can't think of myself as a resident anymore. I really have to approach this as the boss or the buck stops here person. Did you start that from day one, or was that something that you grew into, or is that something that you don't need to have as an attending?
I think it starts on day one, and some of that is probably externally driven by the fact that we're board collecting, starting at day one. And so you realize that, you're very responsible for the patient and everything that happens during that episode of care. But also, all the small things, your documentation, your billing, how you, set up your clinic such that you'll have enough time to spend with patients. And you'll be able to, collect all the pieces that you need to get to the next step in terms of your board certification. So I think we probably all do it subconsciously, but that is definitely an exercise during that board collection period that really makes you feel like, okay, I'm in this experience and it's different for me than it was when I was a chief resident. And so I think that helps make that switch.
I don't really like using the term work-life balance for surgeons because, especially with my mentors, like work was your life. Like there wasn't really a balance per se. But how would you comment on what you think work-life balance is for you?
Yeah, I agree. I think it's probably like work integration or some work.
Right.
Yeah.
Yeah. Yeah.
I think part of that is just the world we live in where we all have, cell phones and devices and we're easily accessible, all the time in a variety of different platforms. And so sometimes it's hard to shut off from that regard. And sometimes, the right time for me to be doing something might be on a Saturday afternoon or a Saturday morning, like when my head is clear and not necessarily, on a Monday at 3 o'clock when, I'm a little bit tired, by towards the end of the afternoon. I find that I'm much better at thinking in terms of writing, research, and those types of things in the early morning hours. And then throughout the rest of the day and into the evening, I always have energy for, doing operative cases or signing notes or some of those kinds of things. So I think it just depends on, what are the right rhythms for a person. Some people might have a completely opposite schedule than that. I also think that it's important to find time to completely shut off during the day. So there are some, times during the day that I try to protect, particularly if I'm dropping my kids off or taking them to activities and those kinds of things, and I want to be there for dinner when I can. Then those times I really do try to protect them.
Did you always want to be a doctor and a surgeon? Like, is that something that you sort of came forth in kindergarten and was like, this is what I need to do and want to do? Or was this something that developed over time for you as you grew up?
No, I wanted to be a doctor. My father was a physician, and so I really admired him and, the how much he loved his practice. I had no idea I was gonna do surgery at all. I discovered that late, in my 3rd year of medical school and found I really liked my surgery rotation. In fact, I think scheduled it intentionally last because I was dreading it so much. I rotated on it, and I was like, "Wow, this is pretty amazing." Um so, no, not at all. And then kind of going into residency, I, liked all of my rotations, and so, had opted to, go into general surgery and then, liked all of the rotations, but then was increasingly, drawn to plastic surgery and hand surgery. So, yeah, it's been a little bit of a circuitous path. I would not have imagined I was gonna be a hand surgeon.
Was your father a surgeon? What
No,
specialty was he?
he did hematology and oncology.
Oh, wow. Okay. Yeah, my dad's a hematologist too. It's a very different mindset than a surgeon's mindset.
Right.
Um, so at this point, you have accomplished an amazing amount in the time that you've been an attending. What other future goals do you have at this point for yourself that you need to accomplish or plan on accomplishing or want to work towards accomplishing?
I always am striving to, um, take care of take better care of patients, think more critically about the treatment that I can offer them, hone my surgical skills, learn about new, treatments that might be appropriate for a specific condition. So I don't think that, that will always be probably first and foremost on my mind. I think, trying to figure out how to be a better surgical educator. I think I probably have a lot of blind spots in the operating room. I'm, trying not to do an operation, but talk somebody through it. So I'm trying to be more cognizant of that and giving them, verbal cues and advice rather than trying to take over the operation and doing it myself. I think in terms of, research and, the more academic part of my life, I, really enjoy mentoring, students, residents, and other faculty members. So I hope that will always continue. I think there's, a lot of our work now is trying to understand how we can help individuals with substance use disorders, mental health conditions, kind of support them through perioperative care. So I think there's a lot of work to do there, which will be, really enjoyable going forward. Um, so yeah, those are kind of things that I think about over the next 10 years.
When I talk to surgeons, I think the experience that women in surgery have had versus men, especially in uh, either in terms of finding mentors or their residency experience, is different. And they've pointed it out to me multiple times in terms of what that was. Was that similar? Do you find that to be the case for you, or what kind of comments would you make, um, either going through surgical training as as a woman, or now on the other end as a leader, as a mentor yourself now, um, being a surgeon who's a woman?
Um, I think that, as you just mentioned, I mean, mentorship is probably one of the most critical factors in success. Um, True for any specialty or discipline, but particularly, I think, we feel it a lot in surgery. And I think you need different mentors throughout your career. Individuals that are going to be honest with you and tell you, hey, like, you maybe didn't make the right decision with this patient, or, you're need to think about your surgical skills in this area. And I'm thinking about like the surgical attendings that you have when you're a resident, like the ones that give you, critical and kind feedback about, hey, think about doing this a little bit differently. You need more reps. You need to be prepared for a case in a different way. That's really helpful. They may or may not be the same mentors that are going to give you advice about, if you want to take an academic position, these are um, the pieces or skills that you need to be successful and get promoted along the way, particularly during that early career faculty phase, which is important when you're trying to make it to kind of the next level of promotion, which I think is a big point of attrition for women faculty. And then having both, perhaps senior mentors and peer mentors who are helping you along the way when you have, children, loved ones, other partners at home, is trying to navigate all of those other factors. Not everybody's family structure looks the same, but we all have a lot of things that are going on the outside in our professional world. So figuring out how you balance that is really important. And I sought that advice out from different people, perhaps than I did for other aspects of my professional life.
You're only, what, you said 11, 12 years into your practice now, right? And so you're young as a surgeon. Maybe in the rest of society, people look at us and are like, not young, but that's because we have a different sort of career span and sort of arc versus, say, a lot of occupations. But at some point, and we've seen older surgeons either sort of operate until they literally can't hold up a scalpel anymore, or they have exit strategies in terms of like what they plan to do or what aspects of their life they plan on keeping or changing. Have you given any thought to what you will be doing in the distant future for yourself, once you start sort of getting to that point?
Yeah, I think I think you bring up a great point about being mindful of it. Not being afraid that, perhaps this chapter is closing and the next one is starting. Um, I like when I reflect upon my dad and when he retired, he stayed incredibly active in his professional society. He was still taking self-assessment examinations, like well past his retirement. Like
Oh,
on a
wow.
college job. So he, tunes into all the webinars and all that kind of thing. He learned a language. He's, volunteering in a variety of things across the community. And I think um, I don't know exactly what things will look like, but I imagine that I will stay active, hopefully, in teaching it, being able to impart some knowledge or wisdom to the next generation of surgeons, and then traveling, finding ways to continue to expand my own knowledge base. I think will be really rewarding.
When you mentor uh, the people that you have now, what approaches do you take that are different than, say, how maybe you were mentored, or is it exactly the same? Like, how do you how do you make sure that you are reaching the young students, residents, trainees that you have at this point?
Um, I don't know if this is the right thing to do or not, but I try not to be particularly prescriptive, like, you have to do X, Y, and Z. If it's, individuals that come to me and they're interested in a specific research area or topic of interest, I usually try to push them pretty hard to get down to a question that's interesting to them, because if it's not interesting to them, then it's not gonna be enjoyable when they're doing, the project and the work. Um, and I wanna challenge them to think about, what is meaningful rather than what's meaningful to me, what matters the most to them. So that's kind of how I think about it from like a research standpoint. When I have individuals who come to me and they're interested in plastic surgery and they, are wondering, what do I have to do to, you know, make it to the next step, either in medical school or in residency training. I think I probably maybe a little bit more prescriptive because there are some, a few more external metrics as far as that's concerned. Um, but I think that there's, a place and a space for everybody. I think so easy for us to get caught up on, board scores and numbers of publications and how many away rotations that we did. And I think at the end of the day, while many of those things are important, what really matters is that you're, passionate and committed to it, and you're pursuing things that make a difference, in the world around you and are meaningful to you rather than, just trying to write lots of papers to put on your CV.
I think that you need to have that passion for sure. So if you were to ask someone, um, like if I were to ask you and I was a student, I really want to be a plastic surgeon. I have all the passion in the world. This is my dream. This is what I really want to do. But if my board scores are in the toilet, I don't think there's a chance. Like it's such a competitive residency to get into, that you would probably have to say the chances are very small or very little. Like there are certain external metrics that do define whether or not you actually have a fighting shot to be, to get a residency in plastic surgery, for example. So, do you tell students who are looking to apply into plastic surgery, this is really what you need, and without these minimums, you probably aren't going to have a shot?
I think it's, about thinking about their whole portfolio,
I see.
perhaps like one area, and I think the step 1s and step 2s are hard 'cause you only get to take them once. So,
Yeah.
that's a really stressful day, but, there's lots of other things that you can do in terms of, doing some dedicated research time or other academic time or, global, taking time off to do global health or other things to round out, who you are coming into the application process, that will allow you to, connect with other mentors, across our specialty, get the letters of support, that can strengthen your application. I think it's also helpful too, just, if there's places on your application where, you wish things looked a little bit different, perhaps just being as honest and open about that as you can be and saying, yes, I recognize that, this score wasn't exactly what I wanted it to be, but I have done X, Y, and Z things, and I think I'm prepared to come into this residency, for all those reasons. And I think that, while there's, only kind of one chance to take step 1 and step 2, there's lots of different chances and pathways to, move into our specialty. And so trying to encourage, our students that, there's lots of opportunities, is important.
As a surgeon, and now you have a lot of administrative responsibilities and leadership responsibilities, both as faculty in your lab, in organized plastic surgery. Um, we all know surgeons who are really good at being surgeons in terms of their surgical skills, great hand-eye coordination, really good clinical skills in terms of managing patients, treating certain operations, but maybe lack the ability to lead groups, to talk to large numbers of people, to be able to, or be a good organizer, to do the things that it takes to ascend higher in, if you really want to impact more people, either outside of your department or medical school or hospital or organized plastic surgery as a whole. how did you develop those skills? Did you always have them? Were you really good at managing, organizing, communicating, or was that something that you had to pick up along the way as well?
No, I'm not sure. I don't know that I don't feel very good at any of those skills, but I feel like there's lots of opportunities to learn and practice them. And I think in many of the spaces that we're in, either in our professional societies or the institutions or organizations that we're in, there's lots of different leadership development programs that have emerged over, the last decade or so. And I am really encouraged to see that the residents have access to these as well. I often encourage them to, we have several in our department to participate in those, because I think, we're leaders when we're leading our teams as a chief resident. You may not realize it or feel like that at the moment, but all those skills in terms of, your emotional intelligence, your ability to communicate, your ability to be efficient and organized, that matters at 5 o'clock in the morning when you're rounding a team of, 5 other residents and you've got 70 patients to see, just as much as it does, when you're trying to lead a group, in your research team or a clinical team. So I think I'm been really excited to see those programs emerge for our residents. And I think it's about lifelong learning.
What is the biggest improvement you think you've made personally in those skills over the past 11 years?
Um, I hope I'm better at communication. I sometimes, we feel like, oh my gosh, we've said this like 10 times, but then you realize like maybe you didn't say it to the same people 10 times. Maybe you said it in a variety of different spaces. And then, so making sure that I don't think it's possible to over communicate. And I think making sure that you are communicating consistently. Again, back to that point that, we all hear different things from, a single piece of information that's being delivered. And so, um, trying to be as clear and consistent about that is, I think, something that I'm working on. Hopefully, I'm getting better at that.
How do you balance your clinical responsibilities with your research responsibilities, with your other responsibilities professionally? Do you make a conscious choice like, I'm going to be spending X amount doing this, X percentage doing this, X percentage doing this? Or is it just whatever feels most interesting or what needs to be done at a time? Or I need this goal for this, and that's how you sort of divvy it up? Because there's only X amount of days for time, minutes in a day to do anything. So how do you best organize yourself in order to achieve the goals that you want?
Um, I think, well, I think it's related to how I partition out my schedule. So, I have a couple days where I operate a week, and then I have a full day of clinic. And on those days, I'm pretty focused on almost entirely clinical care, signing my notes, making sure I'm following up on whatever patient issues, prepping for cases, making sure that whatever I need for specific cases is all being taken care of. Because I don't know, I think my brain just, it's already kind of in that mindset, and that's easier for me. And then I can, respond to some emails or messages that are relatively quick and don't necessarily, require, a deeper conversation. I block out 1 day a week for my research. And a lot of that is meetings, but I try to break that up so that there's also time to catch up on things and then address some of those deeper questions or things that are going to require a little bit more time. And then I have another day that's a bit of research and a bit of admin. So again, kind of more meetings and those, but it's a little bit of a faster pace because it's kind of back to back meeting. So I try to set aside chunks of time because I find that if somebody is emailing you something that's perhaps sensitive or requires a lot of attention that I can't respond to on my phone, and then email such a vacuum that all of a sudden you realize you haven't responded to it at all. So I think being intentional about your time is something that I have been trying to do better over the last several years, and also leaned on my administrative partner as well to help me with that, saying like, listen, we're going to block off this morning. And maybe I have to add a case on, maybe I don't, but otherwise, like, we're not going to add other like meetings and those kinds of things on there.
Um, if there was one thing that you tell your trainees, your mentees, they look at you, they're like, I want to be Dr. Jennifer Waljee. This is exactly what I want to do. What is the most important thing I would need to do to become you in the future?
Um, Gosh, I don't know. Can follow their path. Uh,
Is that what you did?
um, I don't know what I would tell them. I guess I would, tell them to, stay focused and, and stay committed to the things that are meaningful to them, and do what brings them joy. Because there's a lot of times during the day that are not necessarily joyful and are hard. Um, so, um, you want to make sure that you feel like that you're doing every day are meaningful.
And that's where you got to where you were.
I think
Like,
so.
well, good enough. Well, Jennifer, I really appreciate you spending the time on a Saturday after taking call to share a little bit about your life and your experience. I think it is very inspiring. I think, like I said, it's a challenge. I think anyone to stay at their own training institution and then make it theirs as an attending, and the people that I know who have done that have been the most highly regarded, both at their institution and out. And Michigan Plastic Surgery, let's face it, I think is the premier plastic surgery training program in the world. I mean, not just because I went there, but because I see it on the outside looking in now and having seen other programs. Um, and so it's so impressive to see just how much all of you as faculty and as attendings have accomplished there. Um, and honestly, also how well you have meshed with the senior surgeons there and have sort of taken what they've done and gone beyond. Um, Many of your senior surgeons were also my mentors when I went through, and it was challenging to say the least for for many of us. Um, and for you to excel and thrive there just shows, uh, like you said, you may have found what really interested you and drove you, but like I cannot underestimate, or no one should underestimate, the amount of work, hard work, time, and commitment that anyone who is faculty there has spent to achieve what you have. And so, I find that inspirational, the fact that you've spent the 11, 12 years so far there. And I think that most people who look at your life should also say, I mean, I would say hard work. Like if one of your mentees were like, how do I get to where Dr. Waljee is, I'd be like, you got to work really, 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 really hard because you're not, as much joy that you might get from your work. Like it is probably to have spent your general surgery years, your residency, and then to continue to progress the way you have. Like I can't imagine how much um, you were able to do within that time in terms of uh, being efficient and just not, nose to the grindstone with that sort of stuff. So I really, it's admirable. So that's really cool.
Well, thank you. I feel very privileged to be here, and thank you so much. Um, it's been fantastic to have this discussion, and go blue.
Yes, go blue. And I keep following the new coaching and what the plans that they're having for next year's football season. So I will continue to wear mine and cheer from afar, and I hope our institution continues to do really well next year as well. So thank you, Dr. Waljee, um,
Thanks.
and I appreciate it very much.
Thank you. I appreciate that. Thank you.